Hello. Fighting the fat. India's new revolutionizing medicines for obesity. Hi friends, I am Dr.G.B.Sattur and today we are going to talk about a very exciting topic, treating obesity in India with new medicines. Around 24% of women and 23% of men aged 15 to 49 are overweight or obese in India. We have two medicines that can help us fight obesity. One of them is called Mounjaro, is already available in India. The other drug is likely to be introduced later this year. The first medicine we have is Mounjaro. Its chemical name is tirzepatide, bit difficult name to pronounce. It's made by Eli Lilly Company. In medical terms, it's called a dual receptor GIP and GLP-1 agonist. This simply means it can potentially help lose more weight than other drugs. Chemical studies, clinical studies, and many research studies have shown that many people have lost weight up to 15 to 25% of their weight with this Mounjaro. For example, if your weight is 96 kilos, you can come down to 74 kilos or more. And not only that, it can also reduce the risk of heart diseases like heart attacks. It also helps control blood sugar in people with type 2 diabetes. Mounjaro is taken as an injection every week, once a week, subcutaneously for 4 weeks, just like insulin injection on the abdomen or on the thighs. Initially, the dose is 2.5 milligram, and this dose is taken for the first 4 weeks. You take it on the same day of every week. For example, if you take it on Saturday, you take it every Saturday. Then after 4 weeks, the dose is increased to 5 milligrams, and you have to take this dose for the next 4 weeks. It's also available in higher strengths, but remember, only an expert doctor who knows about these medicines can prescribe it and adjust the dosages. This is not a medicine for cough or cold, and its price is around 15,000 rupees per month. It is in a vial form at present. It also has some side effects like nausea, vomiting, loose motions. In very rare cases, there might be a very small risk of pancreatitis, an inflammation of the pancreas that produces insulin. If you're taking other diabetes medications, your blood sugar might become too low, hypoglycemia, so watch out. Now let's talk about the second medicine, Ozempic. It's made by Novo Nordisk company and it will be available in India in late 2025. Its name is Wegovy. This is also a weekly injection. Its benefits, it's a GLP-1 receptor agonist and is very effective in weight loss. Usually results in 10 to 15% weight reduction. For example, if your weight is 90 kilos, you can lose about 13 to 14 kilos, meaning you will weigh around 78 kilos. It also helps control blood sugar in type 2 diabetes. And yes, it has also shown to reduce the risk of heart diseases. Its side effects are similar to Mounjaro, like vomiting, loose motions. There is a slight risk of pancreatitis too. Some people might get bladder problems. There might be some problems with eyesight in some people. If you are taking insulin, your blood sugar might get too low. By the way, Ozempic, whose chemical name is semaglutide, is already available in India as Rybelsus in a tablet form and is used for treatment of type 2 diabetes. One tablet costs about 300 rupees. These drugs might not be covered by most insurance plans in India. These medicines are not magic wands. They work best when you eat well and exercise, meaning maintain a good lifestyle. You have to take them regularly to maintain their effect. Only expert doctors can prescribe them, and they should be taken under an expert doctor's supervision. They are not suitable for pregnant women or those planning pregnancy. Good results are seen with consistent use over many months. Both Monjaro and Ozempic or Wegovy work in a similar way. They mimic certain hormones in our body that control blood sugar and appetite. In some people, the risk of major heart problems like heart attacks is reduced. There are other benefits too, like lowering blood pressure, controlling blood cholesterol, and even reduce inflammation in the body. I'm very confident that many Indians will be able to lose weight effectively with these medicines, but make certain they have to proceed with the advice of your expert doctor at every step. Monjaro is a drug that has to be used for a long term, like blood pressure tablets or statin for high cholesterol. Now, when you stop Monjaro or the weight reducing drug Wegovy, there are going to be potential side effects. One of them is weight regain because these drugs act by suppressing the appetite and giving that effect of fullness. So when you stop them naturally, your original appetite returns. Second one is the blood sugar effects. As it controls the blood sugar, and when you stop it, the diabetes might go out of control. And third one, when you stop Monjaro, there are likely to be mood fluctuations. There could be some amount of anxiety, some amount of disappointment, and some people experience frustration too. You know that it is to be taken for a very long term. You have to be under the supervision of your own doctor, and lifestyle modification is a must at all levels of your life. It could include the diet to be taken by your dietitian, and of course the exercise as per your own physical capacity. So all in all, the drug Monjaro is very effective in reducing good amount of weight, but has to be continued for a longer time, and you have to go on changing the strength depending on your own tolerance, which your expert doctor does. But when you stop it, it is not without any side effects of the withdrawal of the drug. So at all times make certain you are under your doctor's advice. The same thing holds good with Wegovy, which is likely to be introduced over some time later with some, of course, the changes. Take care and goodbye.